Welcome to the Rights Track podcast, which gets the hard facts about the human rights challenges facing us today. In Series 6, we're asking if and how our human rights are threatened by the COVID-19 pandemic. I'm Todd. In today's episode, I'm delighted to be joined by David Fathi, Director of the American Civil Liberties Union National Prison Project, which challenges the conditions of prisons, jails, and other detention facilities, and seeks to reduce the numbers of people ending up in prison in the United States. In recent months, David and his team have been highlighting the impact of COVID-19 on prisons, and it is this aspect of his work that we're focusing on today. So welcome, David. You join us from Washington, D.C. It's a pleasure to have you here on this episode of the Rights Track.
Thanks very much for having me.
So, David, I wanted to start with just the size of the prison population in the United States. I looked up global prison populations today and see the United States is still leading in this area, which is to say it has the largest absolute number of prisoners incarcerated currently. Is that correct?
That's right. Despite some slight reduction in recent years, the United States still has the largest absolute prison population in the world, about 2.2 million people on any given day, and perhaps even more significant and more disturbing, the highest per capita rate of incarceration in the entire world, a rate that is between 5 and 10 times the rate in what we usually think of as our peer nations, like Canada, England, and Wales, and so on.
But also higher than authoritarian countries as well. Is that correct?
Absolutely, higher than literally any other country in the world in both absolute size of prison population and per capita rate of incarceration. Higher than China, higher than any other country in the world.
It's also distributed quite interestingly. So the U.S. has public or state-run prisons as well as private prisons. So what's the distribution of prisoners between those general groups?
Incarceration in the United States is very decentralized in that we have 51 different prison systems. Every one of the 50 states has its own prison system, and then there's also a federal prison system. And many of those, although not all of them, use private for-profit prisons to confine some portion of their population. So some states don't use them at all. Other states, it's been as high as 40% of their entire prison population have been confined in private for-profit prisons. Overall, nationwide, the private prison population is, as a percentage, perhaps not terribly significant. It's maybe 9-10%. But as an absolute number, again, that is well over 100,000 human beings. So numerically, it's very significant indeed.
And it's like an outsourcing model, right? So despite the federated structure of this and the decentralized structure, there are some states where either there's not enough capacity for prisoners to be in those state prisons, or a decision's been taken somewhere that it is more cost effective to use a private provider in this sense.
Exactly. And there is a very significant problem with lack of oversight with private prisons because they are not subject to the same level of democratic control and oversight as publicly operated prisons. One recent and very positive development, President Biden recently announced that the federal prison system will no longer use private prisons. So that is a very significant and very positive development.
And he's done that for what reason? Just because he wants to take the kind of commodification, if you will, of prisoners out of the system, or it's the oversight question? What motivated Biden to make that change?
Well, this is a return to a policy enacted by the Obama administration, which was then promptly reversed by the Trump administration. And in both cases, when President Obama did it in 2016, and now when President Biden has done it, both of them highlighted troubling findings about the quality of services that are provided by private prisons, the quality of programming and other services to incarcerated people, and the level of safety and security that private prisons provide compared to public prisons. So it really was a question of whether these are facilities that we can rely on to keep people safe and secure and to provide at least some meaningful rehabilitation services to incarcerated people.
Well, I'm glad you mentioned the word rehabilitation because there are different philosophies that drive, the popular support and political support for incarceration. One is a kind of retributive justice, punish the criminal, and another is more restorative in the sense that, yes, punishment is required, but also rehabilitation, because the ultimate goal is to have people do their time and then reintegrate in society and play a productive part in society and economy and polity thereafter. So those two competing philosophies are constantly at play, certainly in policy formation.
Absolutely. And unfortunately, in the United States, with a few exceptions, rehabilitation, it has gone the way of the dinosaurs. It is really not even lip service is paid to rehabilitation as a goal of our prison system. In fact, at one point, the state of California amended its law to specifically remove any reference to rehabilitation as a purpose of incarceration. And in addition to the lack of any meaningful affirmative rehabilitation, like education, like programming, U.S. prisons engage in highly anti-rehabilitative practices like solitary confinement, which very frequently just damage and break people to the point where they are not able to function in society when they do get out.
And so let's turn then to the drivers for the size of the prison population. So what are sort of the main reasons why the United States has such a large absolute number of prisoners?
Well, a lot of ink has been spilled over that question. And it's certainly true that you can't talk about incarceration in the United States without talking about slavery and Jim Crow and structural racism. Indeed, in the immediate aftermath of the US Civil War, after the slaves were freed, there was a deliberate strategy to incarcerate the Black population in the South, to essentially reestablish slavery by another name, so that the ruling class could once again benefit from the free labor of the Black population. And we see the legacy of slavery and Jim Crow today in the US prison population, where people of color in general and Black people in particular are grossly overrepresented. A Black man in the United States today is 6 times as likely to be incarcerated as a white man. But even that isn't the entire story. If you freed every single Black and brown person from US prisons tomorrow, the United States would still have a very large prison population, and again, proportionately larger than Western Europe and Canada. So I think you need to look at cultural factors. That the United States, for whatever reason, does seem to have a uniquely punitive culture, and an idea that when people engage in antisocial behavior, the solution is not to fix them, is not to curb that antisocial behavior, but to harm them and even torture them in some cases. So I think it's a complex mix. Certainly racism is front and center, but it's not the entire explanation.
And so maybe if we break that down a bit, in terms of offenses that people commit that carry a prison term, is it the case in the United States that these are offenses that wouldn't carry a prison sentence in the UK, for example? Or is it over sentencing, or using the full extent of the sentencing that leads to this rise in the prison population?
It's really all of the above. I was watching a British detective show last night in which a woman who had killed 2 police officers got out after 15 years, and there is simply no way that would ever happen in the United States. We have by far the longest sentences in the democratic world. So if you look at a sentence for burglary or manslaughter, or pick any particular crime, in the United States, the average sentence is much longer than it would be in Canada or in the UK or in France or Germany. We have a tremendous number of people serving sentences of life in prison. One in every 11 prisoners in the United States is serving a life sentence. In some states, it's as many as 1 in 6. We have 3,000 people serving sentences of life without parole for non-violent offenses, in most cases, drug offenses. So it is over-criminalization, it is over-sentencing, it is a lack of any preparation of incarcerated people for success when they do get out of prison. It's really all of the above, I'm sorry to say.
And then some of that is linked to the death penalty as well. And the death penalty is also decentralized, although there's also a federal death penalty that President Trump used in some degree. And so you do also find people on so-called death row. So these are people incarcerated, expecting to be executed at some point, but they may spend, upwards of a decade or more waiting for that execution. Is that correct?
That's right. And in many states, people who are sentenced to death are held in automatic and permanent solitary confinement, regardless of their behavior, just simply by virtue of the fact that they are under sentence of death. We brought a lawsuit challenging this practice in the state of Pennsylvania, and the plaintiffs in our lawsuit had been in continuous solitary confinement for between 19 and 27 years. Fortunately, we were able to resolve that lawsuit favorably, and now in Pennsylvania, death sentenced people are held in more sort of normal prison conditions. But it's still the case that people under sentence of death very often spend years and indeed decades in the most harsh and deprived conditions imaginable, typically long-term and uninterrupted solitary confinement.
And quite apart from the human rights objection to death penalty, and we sort of know those arguments, solitary confinement itself and the conditions that you're describing there also fall, shall we say, quite far away from international standards of prisons. Is that right?
That's absolutely right. The United States is an egregious global outlier in its use of solitary confinement. Most countries use it to some extent, but in no other democratic country, indeed no other country of any description that I'm aware of, is solitary confinement such a routine and normalized and integral part of the prison system as it is in the United States. And recent estimates are on any given day between 80 to 100,000 people in the United States are in solitary confinement. And preliminary indications are that has actually increased substantially during the COVID crisis, as many prisons use solitary confinement as an ill-advised and counterproductive response to the outbreak of COVID-19.
Yeah, and I want to turn to COVID now, and I I have a strange entry point for my question, which is I believe that Michael Cohen, the lawyer for Donald Trump during much of the Trump organization, was actually let out of prison early because of COVID and is now under just general house arrest. What's going on there? What do you think happened in sense that his case, on grounds of COVID, was awarded, whereas many other prisoners don't have the luxury of that release?
Well, it's no surprise that affluent and prominent people are treated differently in the U.S. criminal legal system and probably in most criminal legal systems around the world. There have been some people let out early from the federal prison system because of their vulnerability, their special vulnerability to COVID because of age or pre-existing medical condition, but certainly not nearly as many as should be, and not nearly enough to make a difference in protecting incarcerated people from the spread of the virus.
Right. If we then turn really to some of the general questions around COVID, I mean, in the United Kingdom, there's been a phased sort of, we're going to have a phased exit from lockdown, but the philosophy of a lockdown is you're trying to minimize the social contact and community transmission of COVID. Certainly work on the pandemic and elections was very worried about having an ability, in small voting booths and small voting centers, et cetera, people would gather for elections. Do you postpone an election, use a mixed strategy? And we know how that unfolded in the United States. But what are some of the sort of structural and infrastructural questions in the prison system, however decentralized it is, et cetera, that really, really impinge on a policy to keep people from harm, regardless of them being a prisoner or not? COVID will rip through the prisons if you're not careful. So what sort of measures have been taken?
Well, we have to start with the fact that prisons really are the ideal environment for the rapid spread and rapid and lethal spread of COVID-19 or any contagious disease. They house large numbers of people in close quarters, even if they are not overcrowded. They house in the United States hundreds, often thousands of people in a single facility. Sanitation and ventilation are often poor, and we are learning more and more about the critical importance of ventilation and air quality in preventing the spread of COVID. And they house people who are disproportionately vulnerable to become very sick or die if they contract the virus because of pre-existing medical conditions. And the United States prison population is is rapidly aging because of the brutally long sentences in this country and the fact that so many people have either a formally a life sentence or a de facto life sentence. So all of these factors combine to make incarcerated people sitting ducks, just waiting for the virus to rip through their prisons.
And have you collected information on the sort of case rate and death rate just within the prison population?
Yes, I mean, there have been many efforts to do that. Again, it is very difficult because of how decentralized incarceration is in the United States. But whether or not we have precise figures, the general thrust of the data is unquestionable. Prisoners have suffered disproportionately from COVID-19. At least 1 in every 5 incarcerated people in the United States has tested positive, a rate more than 4 times higher than the general population. Virtually every COVID hotspot, place where there have been high numbers of infections and deaths, virtually every one of those in the United States is a prison or other detention facility. So there's no question that incarcerated people, more than possibly anybody else, with the exception of people in nursing homes, have borne the brunt of this pandemic and of the government's failure to take effective action to protect people.
And you've really implicitly suggested some interesting intersectionality here as well. On the one hand, there's an age cohort that people are spending a long time in prison, and therefore the prison population has this age effect. They're old people in prison effectively, and they are more likely to have underlying health conditions that make them more susceptible to COVID. But there's also this racial and ethnic dimension as well. We know from the general population that African Americans and people of color disproportionately contract COVID. And you must be seeing that in the prison population as well.
We're seeing that sort of anecdotally, and there's certainly no reason to suspect that things are better in the prisons than they are in the rest of U.S. society. But shockingly, very few state prison systems are collecting or reporting that data. The data about COVID infection and COVID death rates broken down by race or ethnicity. A number of reporters have tried to get that information, have requested it under freedom of information laws, and with a few exceptions, the prison systems say, "Oh, we don't track that information. We can tell you how many infections we have, we can tell you how many deaths we've had, but we can't tell you the racial and ethnic breakdown." But again, there is absolutely no reason to think that the inequalities that we've seen in the rest of society, the disproportionate brunt borne by people of color, there's no reason to think that doesn't also carry over into our prisons and other places of detention.
I mean, it's extraordinary. A basic data protocol when you're recording things that happen is to include demographic information. When people apply for jobs, they fill out equal opportunities forms. When all kinds of things can be broken down by these demographics. So it feels. If I may say, and maybe I'm risking, politicizing this a bit, it feels a bit intentional. They're not collecting the demographic data.
Well, it's hard to see it as anything but intentional. They certainly collect demographic data on the incarcerated people. Every incarcerated person is classified as white, Black, Native American, Hispanic. And so why they're somehow unable to break down the COVID infection and death data by race and ethnicity, it does seem intentional.
Maybe I could follow on then with a lateral question about other detention facilities. So, during the Trump administration, a lot of people were detained, and it wasn't like it started with him. The United States has been detaining people for a long time. But what knowledge do you have around immigration policy, detention of immigrants, illegal immigrants, and again, the intersection with COVID? Is there information coming into your organization about that phenomenon?
Yes, since COVID came to our collective attention in March of 2020, we filed over 50 lawsuits trying to protect incarcerated people from COVID-19 and trying to seek their release as one essential element of providing that protection. And we filed those lawsuits both in prisons, in jails, which are pretrial facilities, and also we filed a number of lawsuits in immigration detention facilities. So I can tell you that the problems are very similar. Obviously, jails and immigration detention facilities have higher turnover. They have more sort of churn, more new people being taken into custody and being let out of custody than prisons. And so if anything, they are even more challenging environments in which to control and contain a contagious disease like COVID.
Yeah, it's sort of unfortunate to use the word, but there's a throughput there that might be higher than in the prisons. And what sort of success rates do your legal cases get then? I mean, you make an appeal to the prison, to local jurisdiction, to other jurisdictions. How are your cases received by judges?
In the ICE detention, the immigration detention cases, we've actually had quite a bit of success in getting people out. I'd say about 1,000 people have been released as a direct result of our litigation, and many others have been released as a result of sort of the pressure brought by our litigation. By contrast, for people who are held under criminal charges, either held pre-trial in jails or after conviction in prisons, we have been very unsuccessful at getting people out. There have been a few cases in which we have gotten population reduction orders, but very few. We've been more successful in getting various mitigation measures ordered. So, for example, orders that the incarcerated people be tested, that the prison staff be tested, that every incarcerated person be given 2 masks, and that they be promptly replaced if they're lost or damaged. So those sorts of mitigation measures, which are important and we believe do save lives, we've been quite successful with. But in terms of what everyone agrees is the most effective thing you can do, which is cutting the population, which is reducing the population density, we have not been terribly successful, at least on the prison and jail side. We have been more successful with immigration detention.
So we've just emerged from a period of, putatively a strong law and order presidential administration, even though I believe the president gave pardons and early release for certain prisoners as a show of compassion and success, and made sort of political capital out of that. But what are the prospects here? I mean, you have the most incarcerated population in the world. You work in this area to try to get people out and have had some success, but not a lot, and some mitigations put in place. So we now have a new administration, and Biden comes from a very long tradition that's part of the American political culture, and I'm not expecting a revolution in this area. But is there hope in your organization about how we might reduce this population, which is not to say we're going to let all the criminals out, but it's a way of looking at prison differently, looking at incarceration differently, and looking at that whole ecosystem, if you will, differently. Is there cause for hope here?
I think there is cause for hope. One of the challenges is that, as I said, we have 51 separate criminal legal systems in the United States, and so the president has direct control only over the federal system, which incarcerates less than 10% of all US prisoners. The vast majority, over 90% of US prisoners, are incarcerated in state and local facilities over which the federal government has no direct control. So one of our constant challenges in the United States is that we have to fight on 51 different fronts. We have to fight on the federal level to improve things in the federal criminal legal system and the federal prison system, and we have to fight in every single state. That said, we are seeing encouraging signs from the new administration. We are seeing encouraging signs in some states, but it's always going to be a very mixed bag in the United States, because every state has its own legal structure, every state has its own political dynamic, and so the best we can hope for is to make significant progress in a significant number of jurisdictions, and enough to really bring the population down to a significant extent. But there are always going to be holdouts and outliers where our efforts are going to meet with limited success.
But it goes right back to the founding then. This federal structure of the United States is a grand compromise between local, call it states' rights versus federal rights and federal protections and governance. And just as you're battling, state by state, prison by prison, for reform and change, there's been a battle for fighting COVID itself that's been highly federated, highly decentralized, and the big argument about, well, it's up to the states to decide whether they reopen schools, it's up to the states how they distribute the vaccine, and yet the new president's come in with a 100-day plan to get as many people vaccinated as possible and get all the schools open, and yet that federated structure is working in some degree against a general effort to get things moving again. So you're facing very similar challenges by that decentralized structure. There must be clearly advantages to it, but also there's great frustration not to have a central overarching ability to bring about reform in the ways that you're striving to do so.
That's certainly true. And now that the battle against COVID has turned largely to the effort to get people vaccinated, again, we're facing a crazy quilt of not only state by state, but in some cases, county by county differences in what the vaccine priorities are and where incarcerated people will fit in those priorities. And some states have already begun vaccinating incarcerated people. The federal prison system has already begun vaccinating incarcerated people. Others have not. And so that is going to be a major focus of our efforts in the next few months, is to make sure that incarcerated people are not left at the end of the queue for this life-saving vaccine. But again, that is a battle that we are going to have to fight on many different fronts.
Well, this has just been a fascinating journey, really, from general claims about the size of the prison population to drivers for why it's so big and what could be done about that, to the very conditions of confinement and how they intersect with the pandemic. And then, of course, this final piece around how does one fight the pandemic and roll out a vaccine across this very particular population of people in the United States. And it fits, absolutely within a human rights understanding about human dignity and, basic conditions. So it's been an absolute pleasure having you, David, on this episode of The Rights Track. So thank you ever so much. And we wish you the best in all the hard work that you're doing.
Well, thank you for having me.
Thanks for listening to this episode of The Rights Track, which was presented by Todd Landman and produced by Chris Garrington of Research Podcasts. You can find out more about the podcast at www.rightstrack.org. Funding for this series comes from the Economic and Social Research Council. Don't forget to subscribe to our podcast to access all forthcoming episodes and our fantastic back catalogue of 5 series of sound evidence on human rights.